Before taking Xeloda, make sure to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily about 12 hours apart. It's important to swallow the tablets whole with water within 30 minutes after a meal. Do not crush, chew, or split the tablets. If you have trouble swallowing the tablets whole, ask your healthcare professional for advice. The dosage of Xeloda is based on your medical condition, body size, and response to treatment. It's crucial not to increase your dose or use this drug more often or for longer than prescribed, as it won't improve your condition any faster and may increase your risk of side effects. If you happen to vomit after taking a dose, do not take another dose at that time. Take your next dose at the regular time. Also, it's important to note that Xeloda can be absorbed through the skin and lungs and may harm an unborn baby, so women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. Some common side effects of Xeloda include nausea, vomiting, loss of appetite, constipation, tiredness, weakness, headache, dizziness, trouble sleeping, changes in taste, and diarrhea. To help with these side effects, your doctor may prescribe medication to prevent or relieve nausea and vomiting, as well as medication to help lessen diarrhea. If you experience severe nausea and vomiting, or if your diarrhea doesn't stop, it's important to contact your doctor right away. Other side effects of Xeloda may include temporary hair loss and nail changes. In addition, the medication may lower your ability to fight infections, so it's important to tell your doctor if you notice any signs of infection, such as a sore throat that doesn't go away or a fever. It's also important to be aware of a serious skin problem called hand-foot syndrome that may occur while using Xeloda. To help prevent this, you should protect your hands and feet from heat or increased pressure and avoid certain activities that could worsen symptoms. If you experience symptoms that affect your usual activities, it's important to seek medical help right away. Finally, if you notice any serious side effects such as chest pain, unusual sweating, fainting, or a serious allergic reaction, it's crucial to seek medical help immediately. Remember, this is not a complete list of possible side effects, so if you experience any other side effects, be sure to contact your doctor or pharmacist. Before taking Xeloda, make sure to inform your doctor about any allergies you may have, as well as your medical history, especially if you have certain enzyme deficiencies, blood disorders, heart problems, kidney disease, or liver problems. Xeloda can increase your risk of getting infections or making current infections worse, so it's important to stay away from people with infections. You should also avoid contact with anyone who has recently received live vaccines. Be cautious with sharp objects and avoid activities like contact sports to lower the chance of getting cut, bruised, or injured while taking Xeloda. This medication may cause dizziness, so it's important to avoid alcohol or marijuana, and not to drive or use machinery until you can do so safely. Before undergoing surgery, be sure to inform your doctor about all the medications and products you use. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks and benefits of using Xeloda. Women should inquire about reliable forms of birth control during treatment and for a certain period after the last dose. Men should also inquire about reliable forms of birth control during treatment and for a certain period after the last dose. Women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. Breastfeeding while using Xeloda is not recommended, so it's important to consult your doctor before breastfeeding. Now, let's talk about the uses and important details of Xeloda. Xeloda may interact with other medications, which can change how they work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Xeloda is allopurinol. Additionally, it's important to note that capecitabine, the active ingredient in Xeloda, is very similar to fluorouracil. Therefore, it's advised not to use medications containing fluorouracil while using Xeloda. As always, it's important to follow your doctor's recommendations and guidelines when taking Xeloda. If someone has taken too much Xeloda and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 for emergency assistance or contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control centre for assistance. It's important not to share Xeloda with others. Your doctor may also request lab and/or medical tests, such as bilirubin, complete blood counts, and kidney/liver function tests, while you are taking this medication. Be sure to keep all of your medical and lab appointments. If you forget to take a dose of Xeloda, just skip that dose and take the next one at your regular time. Make sure to consult with your doctor if you miss a dose. It's important not to take a double dose to make up for the missed one. Make sure to store Xeloda in a tightly closed container at room temperature, away from light and moisture. Never store it in the bathroom and always keep it out of reach of children and pets. When you no longer need Xeloda or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless directed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.